In March 2026, Pfizer announced a vaccine against Lyme disease. 70% efficacy. Phase 3 trial. Everyone celebrated. Nobody read the fine print. Because Lyme disease is one of at least a dozen diseases ticks carry, and the vaccine does nothing. Nothing about the other 11. But that's not even the part that should scare you. The part that should scare you is this. There is a tick-borne virus that can put you in a wheelchair. It has no vaccine, no treatment, no cure, and it can infect you in 15 minutes. 15 minutes before you've even noticed the tick is there. And the advice your grandmother gave you, burn it, twist it, smother it in Vaseline, doesn't just not work. It makes it worse. Today we're going to talk about ticks. Specifically, everything you think you know about them is wrong. And some of what you don't know could change your life forever. Let's go. You found a tick on yourself, or your kid, or your dog, and you've done one of two things. Either you panicked and grabbed the first thing available, tweezers, fingers, a match, and squeezed and pulled and twisted until it came out, or didn't come out, or the head stayed in. Or you looked it up online and found 17 different pieces of advice that all contradict each other. Petroleum jelly, nail polish, rotate counterclockwise, burn it, wait for it to back out, freeze it. Doctors have been correcting this advice for 30 years. 90% of patients still get it wrong. 90%. The correct information exists. It's on the CDC website. It's in every medical textbook. And it has made almost no difference. Because the wrong advice spreads faster. It always has. But the wrong removal method is actually the least of your problems. Because by the time you're removing the tick, for some diseases, the window has already closed. Here is the thing nobody tells you at the beginning of tick season. The tick you need to worry about most is the one you will never feel. Nymph ticks, the juvenile stage, are between 1 and 2 millimeters, the size of a poppy seed. They don't hurt when they bite. They produce an anesthetic in their saliva. You won't itch. You won't notice. And they are the ones responsible for the majority of tick-borne infections. The adult tick that you can see and feel? That's not your main problem. The invisible one is. Act 1. Everything you were told about removing a tick is wrong. Let's start with the match, or the lighter, or the hot needle. The logic seems sound. Heat makes the tick back out. But what actually happens is different. Heat causes the tick to panic, and a panicking tick does exactly one thing. It regurgitates. It vomits its stomach contents, partially digested blood, bacteria, viruses, everything it's been carrying, directly into your bloodstream. You haven't removed the tick. You've given it a reason to inject you. Petroleum jelly, nail polish, essential oils. Same problem. You're smothering the tick. It can't breathe. It panics. It vomits. Twisting, squeezing with your fingers, grabbing the body instead of the head. You're compressing the tick like a syringe. Everything inside goes into you. The correct method is simple. Fine-tipped tweezers. Grip as close to the skin as possible. The head, not the body. Pull straight up with steady pressure. No twisting. No jerking. No heat. No chemicals. That's it. That's what 30 years of medical advice has been trying to tell you. 90% of people still don't do it. And again, for some diseases, it doesn't even matter. Act 2. The vaccine that everyone got excited about. Lyme disease is the most common tick-borne illness in the United States. About 475,000 diagnosed cases per year. Probably more. It's notoriously underdiagnosed. For decades, there was no vaccine. There was one, Lymerix, approved in 1998. It was pulled from the market in 2002 after public pressure based on largely unfounded safety concerns. 20 years of no vaccine. In March 2026, Pfizer and Valneva announced Phase 3 results for their new candidate. 70% efficacy. Planning to submit to the FDA. This is genuinely good news. Lyme disease is serious, debilitating, and in some cases, chronic. A vaccine would help hundreds of thousands of people. But here is what the press releases didn't emphasize. Lyme disease is caused by one specific bacterium, Borrelia burgdorferi. The vaccine targets the outer surface protein of that one bacterium. The same tick that gives you Lyme can also give you babesiosis, anaplasmosis, ehrlichiosis, and Powassan virus. The vaccine protects against exactly one of those. You're vaccinated against Lyme. You hike through tall grass. You pick up a tick. The tick gives you anaplasmosis instead. The vaccine did nothing. You went the hiking trail thinking you were protected. You weren't. Not fully. Not even close. Act 3. The one that can make you an invalid. Powassan virus. Named after Powassan, Ontario, where it was first identified in 1958. It's rare. That's the first thing people say when you bring it up. And technically, it's true. A few hundred cases reported in the US over the past 20 years. But here's what rare actually means in this context. It's rare because it's rarely tested for. Symptoms look like flu, then like a bad flu, then like something neurological. Most doctors don't think to test for Powassan until it's progressed significantly. It's almost certainly underreported. And when it does progress, 1 in 10 people with severe Powassan virus infection dies. 1 in 10. 50% of survivors experience permanent neurological damage, memory problems, persistent headaches, muscle wasting, seizures. Some people never fully recover. Not in a "I had a bad illness" way, in a "this changed who I am" way. There is no treatment. There is no vaccine. There is no cure. Doctors manage symptoms and wait. Now here's the part about 15 minutes. Lyme disease requires a tick to be attached for 36 to 48 hours before it can transmit. That's why the advice says check yourself after being outside. If you find and remove a tick within a day, you've probably avoided Lyme. Powassan virus lives in the tick's salivary glands, not its gut. The moment the tick bites, saliva enters. Transmission can happen in 15 minutes. 15 minutes. You sat down in the grass for lunch. You got up. You drove home. You showered. You found nothing. The tick was there for 15 minutes. It's gone now. Left on its own. Left no mark. And the virus is already in you. Your daily tick check, the thing every outdoor guide tells you to do, does nothing against Powassan. By the time you're looking, it's already happened. Nobody fixes this. Because rare doesn't get budget. Rare doesn't get headlines. Rare gets a paragraph at the bottom of the article about Lyme. Act 4. The scale of the problem nobody talks about. Ticks in the United States carry at least a dozen pathogens capable of causing human disease. Lyme, babesiosis, anaplasmosis, ehrlichiosis, Rocky Mountain spotted fever, Colorado tick fever, tularemia, Powassan virus, alpha-gal syndrome. Yes, ticks can give you an allergy to red meat. Several others. 1/3 of all black-legged ticks tested carry at least one pathogen. One bite, one tick, multiple possible outcomes. And you won't know which one for weeks. Between 2019 and 2022, all 50 states and Washington, D.C. reported cases of tick-borne disease. This is not a forest problem. This is not a rural problem. New York City, Los Angeles, Philadelphia are in the top 5 most tick-infested cities in the country. You don't have to go hiking. You need to sit in a park. You need to have a yard. You need to walk through a patch of tall grass between the parking lot and the grocery store. Climate change is making this worse. Milder winters mean ticks survive longer. Expanded ranges mean species that used to be regional are now nationwide. 2025 was described by Johns Hopkins researchers as a hot year for ticks. The trend is up. There is one vaccine candidate in regulatory review for one disease out of 12. The other 11? Nothing in the pipeline that's close. So here is where we are. The tick that infects you will probably be the size of a poppy seed. You won't feel it. Its saliva numbs the bite. You might not find it. If you do find it, the advice you'll reach for first, burn it, twist it, smother it, will make things worse. The vaccine being celebrated right now protects against 1 out of 12 diseases the tick can give you. And the worst one? The one with no treatment, no vaccine, and a 50% chance of permanent damage if you get the severe form, can infect you in the time it takes to eat lunch. This is not a reason to never go outside. Ticks are manageable. Long sleeves, pants tucked into socks, DEET repellent, tick checks after every outdoor activity, fine-tipped tweezers at home. These things work. They're just boring. They don't make headlines. They don't get shared. The wrong advice gets shared. The right advice sits on the CDC website and waits. A bug smaller than a sesame seed can take away your memory, your motor function, your ability to work, your sense of who you are. And the main thing standing between you and that outcome is a pair of tweezers and knowing not to reach for the matches. Nobody fixed the advice. Nobody fixed the vaccine gap. Nobody fixed the awareness problem. You just have to know. Next week, why does your printer always break the day before you need it? Not when you're printing nothing. Not on a quiet Tuesday. Always. The day before. That's not bad luck. That's also not an accident. I'm Nobody Fixed This. Subscribe if you want to keep knowing.